infection prevention and control. Please wash your hands. Infection prevention.
We looked at the pelvic floor muscles and we described the superficial pelvic floor muscles where we had the membranous sphincter of the urethra, we had the bulbocavernosus, which is like a bulb that covers the orifices. We looked at the ischiocavernosus, which is coming from the ischium to the pubic bone, and then the transverse perineum and the external anal sphincter. Now we'll have to look at the superficial pelvic floor muscles. You will look at the diagram and appreciate them. Let's now look at the deep pelvic floor muscles. The deep pelvic floor muscles are three pairs, and their anatomical name is known as levator ani. Some people like calling it levator ani. So levator ani is a deep pelvic floor muscle. Its collective name is that. The levator ani muscles are most substantial, and of those three, they are attached to the pelvis like a hammock, whereby in front they are attached to the lateral part of the symphysis pubis, behind they are attached to the ischiospines and the pubis, and then laterally they are attached to the obturator foramen, and then the other two levator ani muscles meet to form a gutter which stops and are perforated by the three canals, that's the urethra, the vagina, and the rectum. So what are those levator ani muscles? The examples are, one, we have the pubococcygeus. Why pubococcygeus? This is a muscle that runs from the pubic bone and is inserted into the coccyx. The deep pelvic floor muscles are found inside the pelvis, and we have, this is the pubococcygeus muscle. This one that you see inside here is the pubococcygeus muscle. It runs from the pubic bone and is inserted into the coccyx. Then we have another muscle known as iliococcygeus. The iliococcygeus muscle is a muscle that runs from the ilium to the coccyx. The iliococcygeus muscle is this one. It runs from the ilium. Inside here there is an ilium. It runs from here, the ilium here. You can be able to see this muscle that runs from the ilium and it is inserted into the coccyx. This is called the iliococcygeus. Then we have the ischiococcygeus. The ischiococcygeus muscle is running from the ischium. It runs around here, the ischium, and is inserted into the coccyx. Ischium, coccyx, ischium, coccyx. So those are levator ani muscles. They are anus or rectum, and they try to support the inside organs. You have to look at the diagram of the deep pelvic floor muscles, and you people must learn how to draw the diagram. Remember, the pubococcygeus runs from the pubic bone to the coccyx, iliococcygeus from the ilium to the coccyx, and then ischiococcygeus runs from the ischium to the coccyx. Those are the levator ani muscles, and that is a diagram that you can be able to see. Note, take note of this, that when a woman is in labor, towards and during second stage of labor, the anterior pelvic wall moves upward and forward. Then the bladder and the lumen of the urethra are going to be pulled upwards, becoming abdominal organs. So urine here is going to be retained, and the mother will not be able to empty her bladder. Neither are you going to pass the catheter and you'll be able to find urine, because the lumen will have been pulled in the anterior pelvic wall. Then the rectum is also going to be compressed by the presenting part, by the posterior pelvic wall. So all the fecal matter that is going to be in the rectum will be forced to escape as the mother is bearing down. But now I want to tell you that if a woman delivers The pelvic floor, the bladder, the urethra, they all attain their pre-delivery shape. That is when the fetus has been delivered to the mother's abdomen, and you shall find that they regain back their pre-delivery state. Now, when they regain back their pre-delivery state, that is called the swing door mechanism or the swing door action of the pelvic floor muscles. Pelvic floor muscles give way such that the fetus can be able to pass, and the fetal parts can also all be delivered. So the anterior pelvic wall gets displaced, and the posterior pelvic floor muscles are also displaced because of compression of the fetal head, and you find that all the fecal matter escapes. But as they run back to their pre-gravid state, you shall find that they get that swing door, which is the swing door action of the pelvic floor muscles.